conversational. And I just want to welcome everybody to this session, the Children's Health in Focus session, where we're going to be focusing on summer hunger, addressing food insecurity in children, something that our national network does year round, but we're particularly concerned during the summer. So if you go to the next slide, Mahul. So a few housekeeping things before we get started. We ask that you keep yourselves muted if you're not speaking. We do want this to be participatory, so please post your questions in the chat, and we'll get to as many as possible throughout the session. And then we will provide a post-session survey that we do ask you to complete because we do these regularly, but we're always looking for ways to improve and understand our audience better. All right, so with that, for those of you who are not familiar with Children's Health Fund, we believe that every child in this country deserves quality health care. And when we say quality, we mean comprehensive, medical, dental, mental health, and having their social drivers of health met. Children's Health Fund, we've been around since 1987. We lead a national network of 24 programs, in 15 states, DC and Puerto Rico, that bring comprehensive health care services to children growing up in under-resourced communities, whether urban, rural, or in between. Our marquee program for doing that is mobile medical clinics. However, we also have school-based clinics, telehealth services, and you can see the map here where we're at around the country. And we are, as part of our new strategic plan, we're exploring to expand to other sites. So we're going to be looking at that. But today, we're focused on one of our West Coast partners in the San Francisco Bay Area, the Stanford Health Van. If you can go to the next slide. But before I introduce our guest speaker today, I think just a couple facts here. There are nearly 30 million children in this country that participate in the U.S. Department of Agriculture's school breakfast or lunch programs. It's either free or reduced. The USDA has a summer nutrition program for kids that any of you that are out there looking for ways to ensure that children don't go hungry this summer should look into this. There's the Sunbucks program that provides a $120 grocery benefit per eligible school-age child. Then there's Sun Meals, where families of the children can pick up meals at schools, parks, and other community sites within their own neighborhoods. And some even have meals to go programs where you can pick up or have meals delivered in more rural areas. If you want to know more information about the USDA's program, there's a site finder map that you can go to on their website, and you can see where children who qualify for free or reduced meals in school can also access those meals during the summer. So if the next slide, please, Mahul. So with that, I want to introduce Rosa Maldonado, who is the Teen Van Assistant Clinical Manager for the Stanford Medicine Children's Health and the Stanford Health Teen Van. This van has been around since 1996, and Rosa herself has worked on the van for going on 18 years, if I'm not mistaken, right, Rosa? And
that's correct.
She's been with the Stanford system for more than 25 years. So with that, Rosa, I'm going to turn it over to you to talk a little bit about your program. If you go to the next slide, Mahul.
Hello, everyone. And we have been, like Arturo said, we're actually working on our 28th year with our program. We see teens ages 12 to 25 who are uninsured, underinsured, or homeless. This particular site is one of our sites, and we recently received a grant that has allowed us to provide food for some of our families that have need for food.
So Rosa, one of the things that you reminded me of when we were talking about your program is that you focus specifically on teens and youth, homeless youth, and those that don't have insurance or enough insurance. Can you share with us, maybe to get this started a little bit, are there any stories or a particular teenager that comes to mind that you've seen recently or that I think might help set this up about why this program is so important?
So our program, actually, this particular site, these are kids who have just gotten out from juvenile hall. A lot of them come out, they're pretty much homeless. They do actually have what they call little homes that they built. They are able to house them there to let them get a little bit, collect a little bit so that they can actually get an apartment or a place to live. Some actually have not seen a provider for a while, and a lot of our sites, the newcomers are trying to get into one school, or they are lacking vaccines, which they can't get into school. So we've been kept pretty busy, and actually it's been a challenge for 2 days a week that we go out.
Can I ask you a question? Because this question comes up often for me and those that work on mobile clinics throughout our network. As I look at this beautiful pictures of the mobile clinic and people can see what it's like, but why do you need a mobile clinic? Why not just do this at fixed site clinics in those communities?
So transportation is an issue for many of our patients. Us coming to the students or patients, it takes that barrier out. We have a lot of families that actually are not, they don't have insurance, so they don't have a clinic to go to. They don't know how to apply. They don't know where they can go. And even once they have insurance, they'll come back because they don't know how to use it. The confidence of, providers, sometimes they'll go and, they might have not been treated properly. So they keep coming back to us, even though we try to, it's just like a bridge where we're bridging patients to a forever home when it comes to medical. But they come back. They come back.
Okay, great. Thanks for sharing that. If you go to the next slide, Mahul, we have some numbers about the program. My understanding is in the Bay Area, about 12% of the population, or more than 870,000 individuals, are food insecure. 500,000 of those families are in San Mateo and Santa Clara counties that they rely on food banks. That much we know, right? Tell me about those areas, and my understanding is that's where you put a lot of your service sites, where you go to frequently, both those counties.
That's correct. We do service the San Mateo and the Santa Clara areas. As you know, the Bay Area is a pretty extensive and expensive area to live in. And, we have families that will have to make that decision on whether to eat a healthy meal or, pay their rent. I mean, eating healthy meals can be expensive. And some families, are barely making it, just to pay their bills. We've had quite a bit extensive amount of families that during the summer is when they struggle also, because yes, they do provide meals, but that means they have to get to the place where they provide the meals. And that could be actually a challenge for many of our families. A lot of them actually use public transportation, or they will walk. It's not like I can, they have a vehicle to go from from point A to B. And this is actually one of the biggest problems we have, not only throughout the school year, but with this small grant that we've been able to receive, we've been able to send through Instacart food to their home, at least until they actually connect with one of the other institutions for food. And that could take about a week.
And you use Instacart. And
Correct.
I have to ask, who pays for that service?
So through actually this grant, we were able to pay for, I mean, it's such a minimal cost for, to be able to send the food to their home. Or we've had patients that live in a shelter, and even though they're in a shelter, they don't provide, certain meals. So we actually send the food to the shelter for them.
Yeah, that's a great model. And you've mentioned transportation issues a couple times. And like a lot of our network partners, we've been dealing with that and addressing that since the beginnings, 1987, because we understand what are now referred to or have been for the last decade, social determinants or social drivers of health. This has been part and parcel what we do every day throughout our national network, right? So I just want to emphasize, I don't think this is new for you to be thinking about transportation barriers and
That's
hence
right.
use of the mobile clinic, but also even more than that, even when you're at certain sites, it's still tough for people to get from point A to point B because they don't necessarily have, when we think of places like San Francisco, people think of a condensed city that has public transportation, the trolleys or buses or what have you. But apparently that's not the case in the surrounding areas. So I think that's really important important point that you keep emphasizing. So as we know, before COVID, we had issues with quality healthcare access for children, which includes access to healthy foods. Mental health issues have increased. I think everybody just knows that, right? So have other issues around healthcare access. Can you say what you're seeing on the ground that's a little different today that maybe, you know, versus 2019 before the COVID-19 pandemic? What have you seen that's different?
We had newcomers, I mean, at all times. But the increased amount of newcomers into the country has, I want to say, doubled or tripled. And one of the biggest problems we have here in the Bay Area is that those families that actually are presently in a home clinic are even struggling to get appointments. Because of a lot of the newcomers, they can't handle the amount of families that are coming into the country. So we've been actually at times seeing kids who already have the Medi-Cal, but they can't be seen to even be able to play sports because, they can't get an appointment for 3 or 4 months. So we've been actually helping some of, it's not the teen's fault why they can't get an appointment. We always encourage them to try their provider first. But we're finding that even with their own provider, just to get an appointment is taking a long time because of the amount of families that are trying to pass the border and, they are here and trying to also receive services that is just overwhelming a lot of the clinics.
Yeah.
That's what we've seen a lot of.
Yeah, and I think you know how I feel about immigrants, but regardless of anybody feels about it, having been an immigrant myself, that regardless how you feel about immigrants, in the end, these are children and families who are struggling. And for however long they're going to be in this country, it behooves us to really do what we can to have them be as healthy as possible, including access to healthcare, access to healthy foods. And otherwise, if it's going to be more costly in other ways, they'll more likely end up in emergency rooms, more likely end up hospitalized. It's just not going to end well. And of course, mental health issues that surround any child population, but certainly people have been traumatized in their home countries. They're going to surface in a different way or manifest in different ways. So I'm glad that you're there. We don't discriminate regardless of race, ethnicity, sexual orientation, or a place of birth for a child. And that's who we are. We just see that child, no judgments, and provide the care that we all think every child deserves. So there have been recent increases in minimum wage, and I think California has been one of the leaders in that. But as you've told me, one of the challenges, as much as that has gone up, it hasn't been enough. Can you say more about that? How some families that you're seeing on the ground are struggling with being able to afford healthy food?
Yes, it increased minimum wage, but unfortunately, a lot of you know, fast food places have cut their overhead. So a lot of people are losing their jobs. And then not only that, I mean, they are increasing their prices, which one family could have maybe afford, you know, even to go to a fast food place. Now they're thinking twice because they've increased their prices, of course, to overset the increase of minimum wage. There's a lot of fast food places that are now closing down because of the increase of the minimum wage as well. So, you know, those people who are losing their job, you know, end up with no insurance. It's increasing also, you know, people are not being able to get food or even something they can afford. Because as you know, nutritional is expensive. And, you know, it's just, it's a lot for families that, especially for a large family. And a lot of our families are, it's not just one or two, it's, you know, usually families about 4 or 5 and up.
Yeah. So the at the bottom there, we're going to talk about the school meals program in California. And no, that's okay, Mahul. It's okay. It's perfect. It's perfect. We don't need a slide. Thank you. Earlier, I talked about the USDA's SUN program that I know that we all know or have seen in the news that it still depends on states to adopt the program or not. As I recall, as of January, there were more than a dozen states that have opted not to participate in the program. And what that program essentially is providing that benefit for that extra resources for families during the summer when kids aren't in school to access healthy food. California does participate. Can you say more about why in the summer months it's particularly important to focus on hunger? I mean, I know that a lot of these families struggle year round, but in particular for children in summer. Can you say more about that?
So here in California, yes, they do offer that. However, again, they need to, a lot of families don't know about it. So it's a lot having to explain where they can. A lot of people actually, they may not have forms of transportation, or it may mean that, you know, they're working during the time that they are offering the food that they can go and pick up. So there's a lot of factors for a lot of our families, you know, even though they are out there, you know, we've had food banks around here in this area that literally are running out of food to be able to give to families. You know, so there's a lot of organizations doing a lot of food drives and things like that, just to actually to be able to restock a lot of the food banks around in this area.
Right. So I'm glad that you're there to help out. I'm glad the food banks are there. I'm sorry to hear that some of them are even struggling to get enough food. That tells us obviously there's a need, and we know this is a problem around the country.
Right.
There can be a lot of stigma in some cultures, I would say most, associated with asking for food. How do you incorporate, because I think it's important for people to understand when we talk about comprehensive healthcare, we're really talking about integrating all of it into a visit. How do you do this? How do you go about asking? How do you know who's struggling for food?
So we have a questionnaire that we give each patient that comes in that actually not only for mental health, but also for food insecurities. That is one way that we actually find out. And you're right, there is a stigma out there, even in some of our school sites, even though they have the free lunch, there is certain kids that, you know, there is, you know, other kids who can afford to, you know, go out and get something to eat. And, you know, they see the kids that are eating the free lunch, and sometimes they refrain from getting the food because of the stigma. You know, and it's pretty substantial in a lot of our school site, which is the reason why we have started to put out like snacks for the kids, some fruits, so that, and we don't question, they know that they can come and get, what we have available. We have also started having some bags of food with non-perishables in it, for kids that actually we know that are in need at that particular moment. So just to cover that gap until we can send them food that they need.
Yeah, yeah. I think it's important that we respect and understand the dignity of everyone, including the poorest. And I'm curious though, if you are providing food as part of your healthcare services, word must spread in the community about this. So do you see more of a demand for both health services and food that you think you might normally see,
Oh,
especially in
definitely.
recent years?
Yes, yes. I mean, mental health, food insecurities, and just medical needs is increased. I mean, I double, I want to say a little more than double.
More than double. Wow. And I don't know if you have this number, but if you had to guess, how many, the percentage of kids that you see that need help with getting healthy access to healthy foods? Would you say one out of every?
I'd say maybe 2 out of every 10 kids that we see.
Substantial. And those are the ones that you know about, right? Because it's
Correct.
even with a questionnaire, it's tough.
Right.
Okay. So I know you like a lot of our programs are grant driven, because
Right.
even when you can get reimbursed for Medicaid services for the kids that do qualify and are enrolled, it's not enough to cover the services, right, that you need to provide. If you had extra resources, what would be the next thing you did?
Sites. At the present time, we only go out twice a week. I get requests from different organizations for, they want the van to come out, but, we're only out there 2 days a week, and the demand's out there. It's not the funding that we don't have.
Wow. So you go out 2 times a week, and it's
Right.
all because you have the capacity to do more.
Correct.
You need the funding to be able to do that.
That
But the need is, based on what you're saying, certainly there.
Oh, definitely, definitely. I mean, I get at least 2 to 3 requests a month, but they want a little more continuity where we're able to go at least once a month. And we're to capacity right now. I have 11 different sites that I actually have to rotate in order to cover even them in 1 month.
Wow. Okay. I want to see if I'm looking at the chat. There's no questions, but I want to pause for a second because we only have a few minutes left, and I do have one last question for you, Rosa. But I want to see first if there's any questions, and give people a second to do that. Yeah, so we got a question from Jill. How do you find patients? What's your outreach, word of mouth, mostly through partners? How do you do this?
So all of those. But we just recently implemented a QR code for our school sites, so that to kind of remove staff from finding out why the kids want to come, they can actually schedule their own appointments. So we're trying to take that stigma away from some of the kids, especially because we do a lot of reproductive health. We have also assisted some of the schools from reducing the teenage pregnancies.
Okay. So all of it. Now we're getting some questions. There was one question I was curious about that Maureen asked. What kind of food do you provide on the van? Can you just give me an example? You talked about bags of groceries. Like, can you give us an example?
Sure.
Something
So
might.
the bags of groceries, actually, we have cereal, like the Kix or the Cheerios. We also provide rice, beans, And, you know, we'll put some peanut butter and some jelly and, you know, bread if needed. And that's just to get them in between until we can actually make a delivery to their home. Now, snack wise, we put out there like mandarins, what's in season, you know, bananas and apples, you know, for the kids too. And then we'll also have like dried fruits and stuff like that in little packages. Everything has to be packaged.
Great. And then Tom's asking, have you connected with any Bay Area chefs that might have excess food that they could contribute? And
So
he mentions a specific one, Alice Waters in Berkeley, but yeah.
So we recently actually, because we were lacking a nutritionist or a registered dietitian, but now that we have a registered dietitian, that is something that she is going to start taking over, where she's going to start doing like demonstrations, something quick that a student can do. A lot of the kids get to school and they come without having breakfast. So what we're trying to do is work with some of the schools so that they can actually go and do a small demo of how to prepare something really quick and nutritional.
Okay.
And we'll be reaching out to some of these organizations around us as well.
All right.
For
Tom,
assist-
yeah, I'm gonna follow up with Tom to see if there's any connections he can make for us in the Bay Area to help you.
That'd be great.
We'll connect you, Rosa. So with that, I'm gonna ask you one last question. If there's one thing alone that people are gonna remember from this that you want them to remember, what would it be?
You know, there is some, you know, per se, there's a lot of stuff that we take for granted. And that's, you know, one might want to take a look around because not everybody has that accessibility. And food being one.
All right. So, well, I want to thank you for not only participating today, Rosa, but also for everything you do each and every day for the kids in the Bay Area. You're an exemplary provider that we are proud to partner with, and we will continue to do what we can to do to support your efforts and look for those resources that you need to go out more days a week and see more kids. So Nadia is reminding us to please take a moment to complete the survey. And I just want to thank everybody in the audience. Feel free to follow us on our social media channels and visit our website, childrenshealthfund.org, and contact us if you have any ideas in ways that you think we can be supported to do more of this work. Thanks, everybody.
Thank you.